What is differential diagnosis for medical rotations? Imagine being in a busy hospital ward, listening carefully to a patient's story, examining them, and trying to figure out what is really going on. That's what differential diagnosis is all about. It is a step-by-step process doctors and medical students use to find the exact cause of a patient's symptoms when many illnesses could look similar. During medical rotations, learning how to do this well is key to becoming a good clinician. The process starts with gathering detailed information from the patient. You ask about when symptoms began, how severe they are, what makes them better or worse, and any other health issues or family history. Then, you perform a physical exam, checking vital signs like blood pressure, heart rate, temperature, and looking for signs that point to certain diseases. Next, you create a list of possible conditions that could cause the symptoms. For example, if a patient has chest pain, your list might include heart attack, acid reflux, muscle strain, or lung problems. You then use your clinical reasoning skills to decide which conditions are more likely based on the information you have. This helps you prioritize which diagnoses to test for first. Diagnostic tests are your next tool. You might order blood tests, X-rays, ultrasound, or other imaging studies. For example, an electrocardiogram can help rule out a heart attack, while a chest X-ray can show lung issues. Interpreting these results helps you narrow down your list further. Sometimes, tests confirm a diagnosis, and other times they rule out certain options. Throughout your rotations, you learn to balance thoroughness with efficiency. You want to avoid unnecessary tests but also not miss serious conditions. Practice is essential. You'll learn to recognize patterns and common signs that point toward specific diseases. Communicating your thought process clearly to supervisors and team members is also part of the skill. Mastering differential diagnosis helps you develop critical thinking and clinical judgment. It prepares you to handle complex cases where symptoms overlap. It also helps you catch life-threatening conditions early, which is vital in patient safety. So, in essence, differential diagnosis during medical rotations is a structured way to sift through all possible causes of a patient's symptoms. It involves collecting data, making a list of potential illnesses, testing those ideas, and finally arriving at the right diagnosis. This skill is the foundation for successful clinical practice and a key part of succeeding in your rotations.